Hi, everyone, and welcome to Module 5 of Dissemination Essentials. Almost a complete set. We're so happy that you joined us today for this session, and you'll shortly meet your trainers, and we'll get going on a very exciting and full session today. Just as a reminder to please mute yourself when you're not speaking. If you'd like to ask a question, we'll all be monitoring the chat box. So feel free to have a conversation in there, or if you like, you could also raise your hand and we'll do it that way as well. Just a note, if you would prefer to have subtitles or not show subtitles, you have that option by following the instructions on the screen. And yes, so if you'd like to ask a question with your voice instead of with your words, or I guess without your typing words, then please you raise your hand and we'll get to you that way. So we thought instead of doing a recap of last month's module, we may start this module with a bit of an icebreaker instead. So we're going to try this fancy Zoom technology to get a read on how you're feeling about joining the webinar today. So in order to participate in this, we'd ask that you, at the top of your screen, if you put your cursor up there, you should have an option that says, it should say view options and annotate, and you have an option to stamp. And we ask you to put a stamp on the line somewhere along that spectrum of how you feel about joining the webinar today. And funnily enough, this webinar is partially about choosing appropriate images. So maybe we'll learn about whether or not these images that we've chosen for this are appropriate from our excellent trainers. All right, already there's quite a range, and quite a range of stamp options as well. So well done. I think I'm somewhere in the middle as well. For the people on the end of the spectrum with the fellow with his head down, I hope that by the end of this session that you're more on the other side, but if not, that's fine too. Weird time of year for everyone, weird times in general. So hope that you're all feeling better at some point. All right, cool. Thanks for participating, everyone, and feel free to borrow this icebreaker if you're ever hosting something really cool technology with Zoom that you can use for engaging people, which is neat. All right, so I'm going to move on to the next screen, and the stamps have disappeared, so hopefully there's no stamping on this particular screen. And I'm going to turn it over to our trainers today. So we're doing a slightly different method of delivery today. We have most of the session pre-recorded, but our trainers are here live to answer any questions, and I'll let them introduce themselves to you now.
Hi, it's really great to have you with us here today, and as Stephanie said, strange times, so we really appreciate you joining us to take part in this. Thanks also for your patience in advance with the presentations. I hope it all works well for you. We are here live. We'll be joining in the chat and answering some questions, but this is partly for my benefit. I've got a brand new cochlear implant just switched on last week, so I'm having to learn to hear differently. So we did that partly for me. So thank you. For those who don't know, I'm Sarah Chapman. I'm one of the knowledge brokers at Cochrane UK, and one of the things I do is to help to edit and run the Evidently Cochrane blog.
And hi, I'm Selena. I am the other knowledge broker at Cochrane UK, working closely with Sarah. Thank you for your honesty on that icebreaker. We hope that we can bump some of you up that slide by the end of this. But yeah, it's good to be joining you this month.
Hello everyone, I'm Moriam Chibuzo. I'm from Nigeria. I work with Cochrane Nigeria, and I'm a senior research officer on communications and information science. So I'm in charge of communications here at Cochrane Nigeria. I'm really happy to be here today, and I believe that we're going to have a fun time. Welcome.
Thanks everyone. All right, I think now is the time where we begin our first part of the video. So I will hand over my screen to Dario to get that up.
Hello, it's good to be joining you this month to talk about how we connect with people through our dissemination products. This month is about making the information relevant, relatable, and engaging for your target audiences, showing that the evidence involves real people, sensitively handling topics or findings that may be upsetting, controversial, or disappointing, and avoiding giving recommendations. We're going to be talking about both the words and the images that we use to connect with people. Images can be a great way of connecting with people, but it's important to choose them really carefully. We need to be aware that images can repel or attract. For example, the parent of an overweight teenager told us that a positive image of an overweight child and their parents that we use with a blog enabled them to feel comfortable sharing that information with their overweight son and for him to engage with it. All too often, we see images like the one on the left of cropped torsos, which are dehumanizing and disrespectful.
Images also have the potential to influence behavior positively or negatively, for example, to model good or bad practice. So an example here, it would be a good idea to show people wearing face masks where and when this was the recommended public health guidance. Images can also support or undermine accompanying information. So for example here, if this image of these dogs playing in the water were to be used to accompany a story about climate change related flooding, that could actually seem quite inappropriate and strike the wrong tone. Really important as well that images can build or damage trust in an organization. For example, this image was used alongside a news story about what the Oxford AstraZeneca vaccine is. And it was met with considerable criticism on social media, most notably by health professionals, because this image is showing somebody taking blood, not given a vaccination. If you get image choice wrong, it can undermine confidence, not only in the information that you're sharing, but also in Cochrane, the organization itself. This is particularly important as a health evidence organization that we are accurately representing health and healthcare topics. People really do pay close attention to the details of images.
Now we'll be looking at item number 4 on the dissemination checklist. And this item says, have you communicated to your target audience that this product is relevant for them? Sometimes it will be quite obvious who a dissemination product is targeted at, but at other times you will need to indicate to your audience whether this product is for them or not. Or you will need to basically tell them that this product is for them. So you will need to decide ahead whether this is necessary or not. And why is it necessary to let your audience know whether a product is for them? It's important so that they will pay attention to that product, so that it will grasp their attention. Remember, this session is all about connecting with people. So you want to connect with your audience by letting them know that this product is for them. Now, there are several ways you can indicate to your target audience that a product is for them. You can state specifically who the target audience is. You can emphasize links to relevant organizations. You can use pictures, audio, illustrations, or other visuals. And then you could also talk directly to your audience by using words such as you or your patients. So I'd like us to look at some examples of this. This is a blog shot from Cochrane UK on negative pressure wound therapy for surgical wounds, healing by primary closure. And the writer of this product has shown in different ways who the target audience is. Firstly, we see a picture of a nurse, at the bottom, and this tells us clearly that this product is targeted at nurses. But more importantly, just beside the heading or the topic, we see evidence for everyday nursing. And definitely this topic implies that this product is for nurses, is to guide their everyday nursing. This is also another example. This is a blog, and it's a blog that's targeted at people who have recently stopped smoking. So basically, it's supposed to help people who have recently stopped smoking to maintain that, resolve. And the writer of this product also has indicated who the target audience is. The first line says, in this blog for people who have just stopped smoking. So that clearly tells the reader that if you're someone who has just stopped smoking, this product is for you. The next paragraph also, gives a hint to who the product is for. The first line says, so you've managed to stop smoking. So by using the word, you have managed to stop smoking, the target audience is also indicated. This third example is from Cochrane, Nigeria. This is an example using a podcast. And this podcast is basically done in another language. And so the language, which is Yoruba, has been indicated under the title of the systematic review. And it says Yoruba. So it's clear that the target audience is Yoruba-speaking people. Below that is a picture of a mother carrying a baby, and that also shows the target audience. Not just Yoruba people, but specifically mothers. So you see that it's just a lay person. This is a mother. She's a consumer, so it's not a nurse. So it's basically telling us that this product is targeted at lay people. In reality, this product done by Cochrane Nigeria is for people who may not even understand English. So it's really targeted at ordinary persons.
We are going to have an activity now, and we are going to be focusing on a review which is water for preventing urinary stones. This review found that for people with a history of urinary stones, drinking more water may reduce the risk of stones coming back and may prolong the time that it takes for stones to come back. And there was no information about possible unwanted effects. We are going to run a poll asking you to choose an image to illustrate a dissemination product about this review. And you can see options A, B, C, or D there. It looks like image A is the clear winner. And yeah, I think that we would agree with you there. We thought that image A, showing a glass of water, is probably the safest choice for this topic. As for image B, showing someone in pain might be fine as well, but these kind of cliched or exaggerated images of pain can be a bit off-putting. Also, something to bear in mind here is that this review is talking about preventing urinary stones rather than treating them, so it might not be the most relevant choice to show somebody in pain. As for image C, that might be perfectly appropriate depending on your setting. And something really key in connecting with your audience is making sure that the images you choose are appropriate for your geographical setting. As for image D, showing a conversation with a health professional could also be appropriate, but something to bear in mind is to think about the setting of the studies included in the review. For example, were they patients in hospital, were these people in the community, and make sure that you're choosing an image that's relevant there. In this case, we'd think that image D, as you all seem to agree, is probably the least suitable. It's the least specific image. It doesn't that clearly signify what this topic is. So yeah, we'd agree with you with image A there.
The next item is about showing that the evidence involves real people. Trials and reviews focus on groups of people rather than individuals, and they're often described simply as participants, a term many people won't be familiar with. Study participants are lifted out of their contexts to make generalisations, and some audiences may see Cochrane reviews as lifeless or impersonal. So dissemination products can have the added value of making the evidence feel more human. So how can we show that the evidence involves real people? There are some really simple things that we can do. We can refer to people, women, children, rather than participants. You can see an example here where you could talk about newborn infants rather than participants. We might also give a more detailed description of who they were and where they were from. For example, here, by giving more information about the newborn infants being very low birth weight and in neonatal intensive care units. This can not only be helpful in making the evidence feel more human, but also in helping people understand how relevant that information is to them. It can also be helpful to show that the review authors are real people too. You can do this by simply referring to the review authors, not just to the review. And some dissemination products, such as news items or podcasts, lend themselves to including the review authors' perspectives. This might involve the authors themselves talking about who they are or their reflections on the review. Here's a nice example of this from a Cochrane news item that includes both the lead author's perspective and also includes a patient story and picture. It talks about the author's motivations for doing the review as someone involved in the care of patients with this condition for many years.
A note of caution, though, about using stories and images. Be careful about using stories and images to show the effects of a treatment, because this could overemphasize benefits or potential harms. It might be better instead to use images of people with neutral expressions, as this avoids suggesting treatment effects. So, for example, the image on the left with everybody looking very happy and smiley to be discussing this particular treatment in the pharmacist's hand, that could imply that the intervention is beneficial. Some other ways you could approach this, you could use stories and images to show what it means for a person to have a health condition or to use a treatment. It's also good to be clear that any stories that you do include, they only show one person's experience, and this, of course, won't be the same for everybody. It can be helpful to clearly distinguish between what the evidence says and any personal views, experiences, or choices that you're talking about. If you're unsure about this, do take a look at Cochrane's spokesperson policy, which you can find on the Cochrane community website. Here we have some top tips from Denise Mitchell, one of Cochrane's plain language summary writers, on how to better connect with your audience. So we'll just play those for you now.
Hi, Denise. We're here.
Hi, Katie.
We're just going to have a quick chat today about connecting with people through language. And in your capacity as a plain language writer at Cochrane, we thought you were the perfect person to speak to. So I've got a few questions for you. As someone who writes in plain language, how do you approach writing?
The first thing I do is to read through all the information that I've got to make sure that I can understand what I'm talking about. Because I think if I can understand it, then I can explain it to other people. So that's how I approach it. Understand it, and then I can explain it in my own words.
And when you're thinking about connecting with people, what do you think really helps in making that connection?
I think the most important thing is to talk to people directly, even if you're writing, obviously. So use a conversational tone, use the active voice, and just like we're doing, just as if you're talking to them directly. I think that's really, really important.
When you say use the active voice, can you give me an example?
Yes. So say we looked for studies, not studies were searched for, or databases were searched for studies. So you're making it much more direct and much more active, and I think it helps the reader to feel more involved in what you're saying.
And any tips on what can hinder connection, hold it back?
Yes, you're aiming really not to give the person an excuse to say, this is not for me, I don't belong here, I don't understand, I can't read this, it's not for me. So what you want to do is think about who you're writing for. We keep coming back to this, but use language that you know that your reader will understand, and don't get bogged down with technical language and difficult terminology and acronyms, because that might make them think that they're not part of your gang, they don't belong, and they won't read on.
And if you've got some top tips to share with the people on the course, would you like to give us a couple of those top tips?
Yes, I think keep it simple, keep your sentences short, keep your paragraphs short, and always put the most important information first, just in case people don't read on. And if you do have to use any technical language, make sure that you explain it.
And if there was only one thing that people left after listening all of this today, one thing they did, what would that top one thing be?
I think imagine the people that you're writing for, and imagine that you're actually having a conversation with them, that they've asked you a direct question and that you're explaining to them what they want to know. So that should help you get the right tone and use the right language. So
that's the end of my questions, Denise. So it's great to connect with you today as another human being and share how I think people could do this better. And that's the end.
Thank you.
Lots of really helpful stuff there from Denise speaking with Katie. So just to recap on some of that, make sure you fully understand what you're communicating first. If you understand it, then you're going to be in a much better position to explain it to others. Imagine you're having a conversation with the people you're writing for. This can really help you get the right tone, use the right language. Talk directly to your reader using language that you know is appropriate for them, that they will understand. Keep it short, keep it simple, your words and your paragraphs. Use the active voice. Put the most important information first, bearing in mind that people won't always read on. And avoid any jargon, acronyms, technical language. And if you can't, make sure that you explain any of those terms.
The next thing that we'll be talking about is sharing the topic or findings when they may be upsetting, controversial, or disappointing. When you want to share a topic that's upsetting or controversial, you need to handle this sensitively. And this is what item 15 on the checklist talks about. Some topics may be upsetting, such as stillbirth, while others may be controversial. Many times this is context specific, and it may differ in different parts of the globe. What is controversial to one group may not be controversial to another group. So we need to consider and remember this when preparing a dissemination product. And examples of topics that may be controversial are circumcision, euthanasia. Some reviews show that treatments have little or no effect or uncertain effects. And for some people, this is helpful. but it can also be very disappointing for patients who had, anticipated, getting some important information that would help them from your dissemination product. And these quotes below show the feelings of some of the patients when they read things that are disappointing or upsetting. The first says, the thing I get quite depressed about is that the difference is so small. I got quite preoccupied with all these types of treatments that didn't seem to be worth the bother. And I've tried loads of them. It's been a really tiresome process. I've just got worse. The second one says, actually, it makes me quite angry. I wonder what the point is. Why are all these treatments here if they don't work anyway? So how can we handle upsetting, controversial, or disappointing findings or topics? Some of the ways are we assess. Firstly, you need to assess whether the topic is likely to be upsetting or controversial. And if so, how is it going to influence your choice of words and images? But beyond assessing, you need to address. And I like these because there are a whole set of A's. All of them begin with A's. So when you are addressing the issue, you need to acknowledge that your topic could be upsetting to the audience, might be disappointing to your audience. You also need to provide alternatives and not just say further research is needed. You need to ask your target audience how they feel about the words and get their input about the topic. And then you need to adapt to, based on the feedback they've given you, their feelings about the topic, you need to adapt your dissemination project to take into consideration what they have shared with you. My co-presenters are going to talk more about this, so I hand over to them.
Here's an example of how you could acknowledge that a topic or finding is upsetting. The authors state that chronic pain is known to have a devastating effect and is both distressing and disabling for children and parents. Here are some constructive alternatives to just saying that more research is needed, that much hated phrase. You might consider highlighting any promising research in progress. That might be something that's been found within the review or outside of it. You could remind people that they may also consider factors such as their values and preferences when making decisions, and that those things are important. You could suggest questions that people could ask their healthcare providers. And you can link to trusted sources of information and support.
But a note of caution about linking to other sources of information and support. Before you do this, do check a few different things. So what are their sources of funding? Do they have any conflicts of interest? Do they have a reputation for being evidence-based or otherwise trustworthy? And are they going to be relevant to the geographical region of your target audience? It can be really helpful as well to ask your target audience, even if that's just one member, how they feel about the topic or findings and how they feel about the images and words that you're thinking of using. People living with the same health condition will, of course, have very varied reactions, but nonetheless, their reactions are more likely to be relevant than our own if we don't have a lived experience of that health condition. They might also be able to advise us about any potential sensitivities or controversies within a particular topic area that we might not be aware of. Bear in mind that if you've worked professionally with a topic for some time, that we might have become a bit immune to its emotional impact. Be aware also of the impact that language can have and any controversies around language used in relation to a particular health condition. For example, knowing that it's more sensitive to say a person with diabetes rather than a diabetic. Always be prepared as well to adapt on the basis of feedback if that comes from a member of your target audience. Even if that feedback comes after you have shared your product and it means that you might have to make amendments or even apologies. And for this reason, it's really important that you monitor any dissemination products you share. For example, if you're sharing on social media, do look out for any comments that those products receive.
So we'd like you to try your hand at this activity. Please read the story below and do the exercise that follows. When you've read the story and you've read about the exercise, we'd like you to put your responses in the chat box. We'd like you to suggest things that you would do or avoid doing in your dissemination product to present the findings sensitively. Suggest things that you would do or avoid doing in your dissemination product to present the findings sensitively. Okay. Tio has made a suggestion. She says that we need to acknowledge that experiences and preferences can play a role in patient decision-making around the intervention. And I think that's very important, very important. So that comes under the A, acknowledge. So please keep the chats coming. Maybe a little prompt. You might want to think about how you're going to, the words you're going to use. You also may want to think about the kinds of images that you would use. Okay, Tio, I'm not really clear on what you typed. You said, or more likely caregiver decision-making in this case.
Yeah, I just meant that if it's, a young baby, then it's more likely to be their parents who are making the decision around the intervention, although that might not be the case every time.
Okay, that's right. That's very correct. Okay. Shayeste has also put in a comment. She says we need to be careful about writing negative comments, and we need to be thoughtful about people's cultural, religious, and ethnic backgrounds. So yes, this is very important. Whatever words we use should not step on what people believe. Rachel, that's a great input you've made. We should use plain language, and we should avoid giving recommendations for or against circumcision. That's really important. You don't want to, because some people don't believe in that particular intervention, or they have reservations. You don't want to be saying you have to do this or you mustn't do that. So that's really a great one from Rachel. Ursula is talking about being specific and clear about what you're really talking about, what the intervention is, and who the participants or the age group is. Thank you for that, Ursula. Okay, Dario has given us a little prompt there. He says, what if someone's beliefs are clashing with scientific evidence? Okay, Adriana says, I was wondering if it'd be better to explore knowledge, attitude, and practices before. Yes, it's good to explore knowledges, attitudes, and practices. And I think this is what qualitative systematic reviews are all about. You don't only want to talk about what the intervention can do or not do. You also want to take into consideration people's knowledge, attitudes, and practices. So that also has its place. But right now, we're actually looking at a situation where you want to present the evidence. Catherine has said that images might include pregnant women or couples meeting with the midwife. I think that's great. We discussed this yesterday with the first cohort, and we talked about, using kind of neutral images. This suggestion is good because it means that you're showing the people that they have a choice. So the fact that the couple is discussing with the midwife means that intervention is not being pushed down the throat of the couple. Thanks. These are all great great things in the chat. I want to just talk about Dario's question. He says, what of when someone's beliefs clash with scientific evidence? So nobody has really talked about that. I think that we still need to be sensitive when presenting the evidence, because the evidence can be quite clear, but what we are doing is not trying to play down the evidence. We're just trying to be sensitive so that we can connect with the people and so that they can read on. For instance, if you put a picture of a child being circumcised and the child is screaming and crying, somebody that doesn't believe in circumcision would probably not even read that dissemination product. So you've put the person off. But when you use an image that is neutral, the person may probably read on. And when your language, is neutral too, the person will be encouraged to at least read what the evidence says. Yeah, Stephanie has put in a chat there too. She says that we need to work closely with our target audience so that they can at least make sense with people who you are, so that you can, the target audience can make sense of what you're disseminating. Thanks, everyone. This has been really great. Thank you for all the constructive chats. Okay, they're all still coming. Jesus is saying, I guess this title is an example of careful election of sex or gender terms. First, the term male is chosen, male circumcision, and men at the end, HIV in men. So thank you very much. I think our time is up for this, activity, so we'll move on. Thank you so much. Well done, everyone. The next item on our checklist talks about avoiding giving recommendations. So you need to ask yourself, have I avoided giving recommendations in my dissemination product? People make decisions not just based on the effects of an intervention, but on other considerations. And some of the other things that people consider are how much the intervention costs. Some interventions may be way beyond the pocket of a particular person, whereas within the reach of others. So these are all things that people consider when deciding whether or not to use an intervention. Another factor that people consider is whether the intervention is available to them. Some interventions are readily available in some parts of the world, and they're not easily available in other parts of the world. So it's necessary to consider that when presenting, the evidence from your dissemination product. Another factor that people consider is it acceptable to me? This, of course, talks about various contexts or settings. It takes into consideration people's religious beliefs, cultures, preferences, personal values. So what is acceptable to one may not be acceptable to another. So people also consider these things when making a decision about whether or not to use an intervention. And the last factor on the continuum says, is it practical or feasible to use? So beyond being effective, beyond being affordable, beyond being available and acceptable to the user, is it practical or feasible to use? If an intervention is not practical to use, people may avoid using it. So these are all things that people consider when making decisions. We therefore do not include recommendations in our dissemination product. Instead, we should aim to provide the best available evidence and then let other people make their decisions. This is a support summary of a Cochrane review. And we can see that in the box by the side, it has stated what the summary includes and what the summary does not include. The summary includes key findings, considerations about the relevance of the research, but it does not include recommendations and additional evidence not included in the systematic review. and detailed descriptions of interventions on their implementation. So the writer of this product has clearly stated that recommendations are not included in this dissemination product. So what are some of the ways we can avoid giving recommendations? We need to choose our words carefully. We need to think through our words and choose them carefully. For instance, you should avoid statements like, there is insufficient evidence to recommend the use of X. This statement inadvertently suggests that sometimes Cochrane does give recommendations. So we shouldn't use statements such as these. We can also think about other ways that we can help people reach their own decisions. For example, we can suggest questions that they may want to ask themselves, others, or even their healthcare practitioners when making decisions. And we may also want to point out factors that they may wish to consider, such as their values, preferences, the cost, and the availability of the treatment.
We've come to the end now of our presentation. We really hope that this has given you some helpful tips on making it clear to your target audience that your product is for them, showing that the evidence involves real people and that the reviews have been carried out by real people, sensitively handling topics or findings, particularly those that could be upsetting, controversial, or disappointing in your setting, and giving you some constructive ways of avoiding recommendations. So on to homework. Just before we finish, we'd like to let you know a little bit more about the tasks that we've set, but don't worry, all of this information is on the learning platform, so you don't need to remember any of this. It's just to give you a bit of a heads up about what's coming. So first up, we have a quiz to test your knowledge of some of the content we've covered today. We've also got a task on handling upsetting topics sensitively. So what we're going to do is ask you to read a made-up news item about Cochrane evidence on self-harm and to list what you'd change about that news item in order to connect sensitively with an audience affected by self-harm. So we've made that news item a bit problematic in some ways. And we'd like you to list as well anything that you might add to make it more helpful and to describe a more suitable image choice than the one we have selected. And then a third task for the review we talked about earlier today on water for preventing urinary stones. We'd like you to choose a target audience and then make a short dissemination product. In particular, using strategies to make it clear to your chosen audience that the product is relevant for them. So thank you very much for joining us, and we hope to engage with you on the learning platform.
Well, thank you so much to Selena, Sarah, and Moriam for your pre-recording and your availability now to answer any questions. I can see that a few have popped up in the chat earlier on about recommendations. So if you'd like to see who would like to answer those first questions, if you can see them.
Yes, I think there have been a few about why we shouldn't be making recommendations and why we should avoid that. And I think that Moriam covered that a bit in the presentation, but basically because, you know, Cochrane reviews are there to give a summary of the best available evidence, but there are so many other factors that will feed into people's decisions about whether they choose to opt to take a particular treatment or intervention or not. You know, things like, is it acceptable to them? Does it align with their preferences and values? Is it available to them in their setting? A very basic example, if we go about saying you should take this treatment, but then it's not available to somebody, that's not a helpful thing for us to do. And all that Cochrane reviews are there to do is to sum up the available evidence and how certain that evidence is, and then that information can be used by people in their own decision making as one of many other factors that will feed into their decision making. I hope that's a little bit helpful.
Thank you, Selena. If any of the other trainers want to weigh in, or Shayesta, if you have a follow-up comment to that, feel free to type it as well. And Catherine has a question about disseminating specifically to healthcare practitioners. She says, my target audience often consists of healthcare practitioners. Is it okay to point out that the results of the review are in conflict with current guidelines if that is the case? And how would you phrase that without making a recommendation?
Unmute first, that's good. But that's really interesting. I mean, something we do have in our blogs where we share Cochrane reviews, and sometimes they are, different from what's in current guidelines. And I think we do our best to turn that into a sort of reflective piece, particularly with a health practitioner audience. That works really well if you've got somebody who is a healthcare professional writing and producing your product. So that's the way we tend to go. And of course, sometimes it's that Cochrane evidence comes along that looks like it might be practice changing and looks like it might change those guidelines. So I think it's not something to shy away from. It's just to be really clear of what's the Cochrane review says, what's opinion, particularly if you've got somebody sharing their views from practice. So it's just about keeping that clarity.
Yeah, I quite support what Sarah has said. I think it's about presenting what the evidence is, and evidence is consistently evolving. Sometimes you have new studies that change tip the balance. So it's okay to put the evidence and let them know that even though this is what the current recommendations is, this is what evidence says. So we know that many times guidelines are reviewed based on new evidence that comes out. But I still think that we can avoid giving recommendations when we present the evidence. It's just to show what we found and then let people make their own decisions. Thank you.
I think as well, just another thought about that, it is to be really clear about which guidelines you're talking about. If you're saying this Cochrane review conflicts with current guidelines, but which country are you talking about specifically? Because it might not be the case that those guidelines are the same everywhere, but the clearer you can be about that, I think the more helpful that will be.
Thanks, Anne Catherine, for your question. I actually had a question that popped into my mind while you were all speaking, and I'm not sure it's a question for disseminators or PR people, but I think despite our best efforts, it may be difficult sometimes to handle things sensitively and to know in advance, something that may cause distrust or upset a certain population. Do you have any advice for if you accidentally, in disseminating, realize or receive feedback that what you've done hasn't exactly been sensitive, what to do next as disseminators?
Yeah, I think that this takes me back again to one of the items on the checklist about our target audience. Sometimes we've already done the product and we're trying to mop up afterwards, but the ideal thing we've recommended in the checklist is to involve the target audience right from the outset. So we are still learning, and that's part of why we are part of this training. So we need to try and involve our audience as much as possible. It's likely someone will bring up the fact that this might be upsetting. But I think that even when we are not sure, we could just try and use words that are pleasant to people generally, that try to be careful in our choice of words, general.
I could chip in there as well. I think that's good advice from Moriam there. I'm just thinking back to the series we did on endometriosis, and my point really is that sometimes you won't, there's not agreement out there in your community. It's really important to involve people with that health condition, but sometimes you just end up in a controversial situation and you maybe just have to hold a line. So we chose to talk about people with endometriosis in our blogs for people with endometriosis, because we recognize that not all people with endometriosis will identify as women. And that did cause some upset amongst people who didn't agree with that. But we decided that we felt that was important, and that access to healthcare would be hard enough for those people in that situation who didn't identify as women, and we were going to go with it. So, but again, really important to just keep an eye on what the reaction is to your products.
That's great advice. Thank you. We have Shayesta is asking if anyone has any samples of phrasing non-recommendations, which is probably pretty tricky, but if anyone has any suggestions they'd like to share in the chat, or if any of our trainers have any suggestions or samples.
We actually have some excellent, we have a quiz for you on the learning platform, and one of the questions is about avoiding recommendations. So we put some phrases in there, some of which are problematic and some of which are safe. So we hope we all have a look at that. But I think in general, if you're familiar with the narrative statements that Cochrane uses, that can be really, really helpful. So for example, if you have high certainty evidence that a particular treatment is of benefit, then it's safe to say that treatment A does this. If it's moderate certainty evidence, you'd say treatment A probably does this. And I think that's your statement there. There's then no real need to go on to say treatment A should be given, but you're just simply saying that treatment A does this, probably doesn't do this, and so on. So I might just find those narrative statements and pop them in the chat if anyone's not familiar with those, that they can be really, really helpful for being very consistent in what you're saying, but also avoiding giving right recommendations.
Thank you, Selena. Does anyone else have any questions today? If not, you still have an opportunity to think about, digest what you've heard today, go on the Learning Experience platform and see what's up there, and ask any questions you may have on the platform. The trainers will be looking out there for any questions or comments you might have. And as always, we have an opportunity to do a bit of a deeper dive into this topic in 2 weeks' time at the Ask the Trainer session. So stay tuned for that as well. But not seeing any questions, I think that we are probably at a good place to give you a few minutes back before any next meetings or things that you may have. So I'd like to give, again, a warm thank you to Moriam, Sarah, and Selena for stepping in and giving us this wonderful session today on very important and sometimes messy topics. So thank you for that. And we look forward to seeing you all again at one of the Ask the Trainer sessions in 2 weeks' time. So take care, everyone, and see you online.